New this morning, Manic Mondays isn't just part of a Bangles song. According to the National Alliance on Mental Health Illness, nearly 1 out of 20 American adults live with some type of mental health issue. In 2021, only 46% of those suffering from mental illness sought treatment. For one Coastal Bend woman, getting the help she needed was the difference between living and not living at all.
It doesn't matter if you believe necessarily in mental illness. You should believe in people, and people should help people.
But not everyone is getting the help they need. Dr. John Lucens with Bayview Behavioral Hospital says mental health is a state of mind. It refers to both illness that can happen as a result of our psyche or as a result of our biological makeup.
A lot of people think of mental health only as something like schizophrenia or somebody being psychotic, but it envelops a broad spectrum, anywhere from substance abuse, anxiety, PTSD, women's health like postpartum depression and postpartum psychosis.
Those seeking treatment for mental health typically receive inpatient or outpatient care, depending on the severity of symptoms. Hospitals and doctors' offices across the country have reported a significant drop in patients seeking routine medical care or checkups due to the pandemic. It was the same for those suffering with mental health.
What the pandemic exposed were some of the cracks in people's ability to get treatment for mental health, or else even get support.
For Sophia Jimenez, the lack of family support and the stigma tied to admitting something is wrong affected her decision to get treatment sooner.
My family didn't really seem to accept any kind of mental health as existing. I never bothered to say anything. I always felt like if I said something, I would be shunned.
Sophia knew something wasn't right as early as 7 years old. It wasn't until decades later, when she was seeking treatment for her wife, who suffers from schizoaffective bipolar disorder, that she began to get help for herself. NAMI Greater Corpus Christi gave her the tools to end years of depression and self-mutilation.
I started on a healthier path and learned skills to help me throughout my day. Since then, I feel like I've been thriving compared to what I was doing before.
As the pandemic started to ease a bit, more people have reached out for help. The challenge now is the lack of mental health professionals to get the job done.
We don't have enough mental health providers, including therapists, psychiatrists, counselors in the Coastal Bend.
Dr. Lucens says the best way to start addressing mental health is by having a good support system. And if you are someone who has a family member or friend suffering from mental health, recognizing the signs and asking questions can make the difference.
It's okay to ask someone, anyone, are you okay today? Not just are you okay in general, but are you okay today?
And I want to thank Sophia for her candid interview about her situation. Now, a troubling statistic is the number of young people who are now dealing with mental health issues because of the challenges due to the pandemic. Mental health professional says for those under 18, 1 in 10 experience a mental health condition.